So first of all, thank you very much, Marianne and ISNTD for having us today. Yes, indeed, the 25th of April, it will be the World Malaria Day under the theme of Zero Malaria, Draw the Line Against Malaria. And this is very much about celebrating also the malaria strategy. A malaria strategy that is based on a number of pillars, and one of them being, as Marianne, you already said, very much ensuring universal access to malaria prevention, diagnosis, and treatments. And what I would like to do today is really to show some of the work that we have been conducting within the Merck Global Health Institute on more activities that are associated with prevention, because we do feel very much that to contribute to the malaria elimination, there's a need to further investigate actions around prevention, hence also the title of our webinar today, Zero Malaria Starts with Prevention. What I'm going to do next is just to introduce you briefly who we are, and then to present a high-level strategic approach that we have applied within our institute, and talk a little bit more on some aspect of some programs. And of course, as you understood, other programs are going to be detailed by the next speakers. So first, just a few words of who we are. So we are Merck, a worldwide company founded more than 350 years ago that is delivering science and technologies through its three core businesses: life science, healthcare, and electronics. And the purpose of our company is really to significantly impact human lives, and that through delivering innovative treatments, empowering the researchers through access to various tools, and also deliver and develop innovative technologies based on the electronic businesses. We are known throughout the world as Merck, except in the US and Canada, where we are known as EMD Serono, Millipore Sigma, and EMD Electronics. When it comes to global health activities, we have a department that is dedicated to improving the health of underserved populations in low and middle income countries through access to our science and technology, and very much also through works with various partners, because we feel that partnership is anyway the heart of many of those activities. More specifically, our global health strategic intent is to contribute to a number of sustainable development goals. And here we are depicting a certain number where we feel that indeed we can have a significant impact. And from a therapeutic indication focus, we have three major pillars. One being a neglected tropical disease called schistosomiasis. And here there is a strong commitment from the company to support the community till elimination of schistosomiasis as a public health problem. On the other hand, we have activities to prevent and control a number of non-communicable diseases. And finally, we have a pillar on malaria, and here our intent is really to support the community toward preventing, but also controlling malaria towards elimination. How do we do this within our Global Health Institute? Our key focus is really to strengthen low middle income country health system resiliency in a sustainable manner, in particular in their capacity to prevent infectious disease transmission and increase their preparedness to react to event volatility. The two topic and the two key disease being for us, of course, schistosomiasis and malaria. So how do we do this? It's by providing sustainable access to technological solutions. It's by supporting access to capacity through workforces, infrastructure building, supporting adequate policy making. It's by looking at our two diseases of interest not as a standalone, but within and including a full range of health challenges to be addressed and to provide a more integrated approach. But it's also to look at digital solutions that may help to predict and be aware of upcoming threats. This, of course, we cannot do it alone. And again, this is about building partnerships and working with experts in the field. So when it comes to how we fight malaria, well, those numbers, unfortunately, you know them already, and they have been already mentioned by Marianne, by Danielle. We are at the point where, of course, tremendous progresses have been made, but there's still a lot to be done. And the way we approach it in our institute is by providing and to address it through an integrated approach that is very much aligned with the global technical strategy for malaria elimination, with a key focus on prevention. That means we are looking at developing treatments from drug discovery and clinical development to come up with new anti-malarials that may address more preferentially prevention. It's about looking at how diagnosis and surveillance can really become pillars of, and pillars as standalone pillars almost, to the malaria strategy elimination, with, of course, a keen interest on, again, fostering and surveillance from prevention perspective. Vector control, and you heard about now Daniel's work on IR3535. This is really looking at developing alternatives against malaria transmission, in particular for outdoor bitings. We know that, as Daniel was mentioning, bed nets and indoor spraying are the key arms for fighting malaria transmission from a vector control perspective, as well as, of course, looking at ways to eliminate larvae. But we know also that a lot of biting is happening outdoors during activities, and people do need to have access to safe solutions that are going also to be ecologically safe. And that's the kind of work that we are conducting there with Live Food and the Noguchi Institute. Then we are looking also at the capacity building. And this is a little bit more on the side, but we feel that treatment, diagnosis, vector controls are key pillars, very much highlighted in the malaria strategy. But capacity building and local capacity building by providing access to essential resources is extremely important also. So this is actually translated today in a series of programs that we are conducting through partnerships within our institute. And here you have depicted a certain number of our partners. We are going to mention a few more later on. And you just heard about the work that we do on the IR3535 with the insect repellent. Here, just to give a little bit more details, we are conducting today with Live Food and the Noguchi Institute a series of testing, very, I would say, controlled testing on cage test, then community-based approach, natural settings, to really assure that we are going to have a solid package to demonstrate to the community also that, well, we may have here a way, another tool to really fight malaria transmission. You're going to hear about the surveillance work through the work that Dr. Isaac Quaye is conducting together with us on the PAVON network, and also the basic work that we are conducting on strengthening a state-of-the-art basic microscopy approach, but a work that needs to be done also of strengthening education of healthcare workers when it comes to microscopy for malaria and beyond malaria, looking at also at other elements of infection. So giving a more comprehensive views on the diagnosis, and this is a work that you're going to hear about from Professor Anang. What I'd like to do now is just to give you just very briefly some elements on the capacity building activities that we conduct, plus then I will zoom on to the more treatment elements. From a capacity building, as I was saying, we feel that to tackle prevention, we need really to strengthen health system also at its basis. And this is a little bit aside from a direct, I would say, control of malaria or elimination strategy of malaria, but addressing the basic access to water and clean water in healthcare center as a means to provide the basis to care for the patients that are coming into healthcare centers, post, etc. In a rural setting, it's extremely important. So that's a little bit on a side project, but for us, we feel that this is the baseline that is very important to tackle. The other program that we conduct in collaboration with the Boston University has to do with counterfeited drugs. We know that counterfeited drugs are leading to death, to increase resistance to a number of treatments that are antimicrobial treatments. And this is a huge problem because from the malaria field, because the two top commodities that are mainly counterfeited are antimalarials and antibiotics, two commodities that are being used for treating our patients. So here, together with Boston University, we've been working for the last couple of years on developing a technology that is mobile, that allows, without any particular training, so very user-friendly, a way of addressing whether the active ingredient is the correct one in the drugs that are available. And not only that, but also to quantify the presence of the amount of active ingredient. So it's really to detect substandard and falsified medicines. And we feel that this is a basic also tool that is going to strengthen the capacity of the healthcare centers and healthcare system to really address the proper need of the patients. And this is also a way of preventing reemergence of resistance and preventing case of death. So another way of prevention. What I would like now to do is to zoom onto some of the treatment activities that we're conducting. And first, looking at what we do from a drug discovery perspective. So we have had the extreme pleasure to have a collaboration, a long-term collaboration now, with partners of Medicine for Malaria Venture, as well as under the leadership of Professor Kelly Shibale with ISNTD in Cape Town University. We've built a drug discovery hub for malaria. Here was the intent on developing the next generation of safe and efficacious antimalarials with a key focus on preventions. What are going to be the next preventive drugs or chemoprevention drugs? But also, of course, looking at alternatives for treatments and to tackle cure. Today, we are happy to say that we are already in lead optimization and that we're aiming for an early development phase by Q2 of this year. So very exciting platform, a lot of very interesting outcomes to come in the near future. Doing drug discovery was also showing us that the researchers that are conducting drug screening and drug discovery, they do need to have the right tools, and in particular the right cellular tools in their hands, tools that have a capacity to translate really into a human setting very early on. And in particular, again, in the perspective of looking at tools that are going to support the community, looking at more preventive treatment, it was very important to address the question of developing cell assays that would be allowing us to do screening and profiling onto primary hepatocytes or onto hepatic systems that would be recapitulating very much the human liver. And that's actually the work that we've been conducting with IBET and IMM in Portugal, together with our colleagues from Swiss TPH, where we have been developing recently a flexible 3D cell-based assay that is based on a human hepatocyte creating spheroids, recapitulating many features of a human liver in terms of its architecture, but also polarization, metabolism. They can be put in culture for a long time, and we've been doing drug testing on them. So this is an assay that you're going to hear about a little bit more this year. The project lead from our side is Thomas Spangenberg, and I think he is going to be communicating quite a bit on that. And I would advise and recommend that if you're interested in getting access to these type of assays, to get to our colleagues. So this is more from the drug discovery and early phase. Now, if we look more at the clinical development perspective, within our portfolio, we have a compound that is called M5717. This is actually a drug that was identified, a compound that was identified by the University of Dundee together with the Medicine for Malaria Venture team. This is a very interesting molecule because it has a new mode of action. It's an inhibitory of the Plasmodium elongation factor 2. But what needs to be remembered about this molecule is that it has an extremely efficacious aspect or efficacy at all the different malaria stage, liver, blood, gametocyte, mosquito stage also. So it's really a nanomolar range efficacy, which makes it, together with his very long half-life, a very interesting molecule that can become a game changer because it can address all the various target product profile needed today to fight malaria. So it has the potential to become a single dose cure, which is what this field is really looking at from a treatment perspective. It can also become a weekly therapy for chemo prevention, and this is really the space in which we're really looking at very carefully how can we position this molecule as being the next generation of the chemo-preventive treatment. But it has also the potential to become a transmission blocker. So a very interesting profile. Where are we now today? Phase 1 has happened. We have realized and we have demonstrated that it's well tolerated. It has, and the long half-life has been validated in a human setting. And now we are at the step where we have also conducted 2 types of human challenges. So those human challenge are healthy volunteers that accept to be infected either with human erythrocytes containing a laboratory strain of Plasmodium, or that can be infected with sporozoites. And then they are being treated at different times with a drug to be tested. And when we have done this with M5717, what we have demonstrated is that we could reach full cure as well as full protection with doses that are quite nice. So now we are at the next step, which is to find the right combination partner to enter in phase 2. So an exciting time. And we are really happy to have and to be surrounded by partners that are sharing the same type of interest to move this program further. And this is leading me to my last slide, which is, again, to go back to prevention. We feel that indeed the preventive topic has to be strengthened also within the malaria strategy. And it comes with a set of tools that today, hopefully we are going to show and to explain a little bit more. I zoomed onto the treatment, Daniel onto the IR35, and so vector control. But now I'd like to pass on to my colleagues to talk more about the diagnostic as well as the disease surveillance aspect. And with this, I'd like to thank you for your attention, and back to you, Marianne.